Hello, everyone, and welcome to the next installment of Child Life in Action COVID-19. I'm Meagan Roloff, Director of Member Engagement and Partnerships for ACLP. As you know, in this series, we're interviewing child life specialists to discuss the impact coronavirus has had on their work and some of the unique and really innovative ways child life specialists and teams are adjusting to this situation, both professionally and personally. Today, I'm thrilled to be joined by Cinda McDonald, and I'm going to turn it over to Cinda to introduce herself.
Great, thank you. I'm really excited to be here to talk with everyone. I work at Baylor University Medical Center in Dallas, Texas, and we're part of the Baylor Scott and White Health. I'm the system level manager for our palliative care child life services team.
Great. Now, one of the reasons I was so excited to talk to you is because your program's pretty unique for child life programs in that you work primarily with children of adult patients, whereas I think for most child life programs, maybe they have one person assigned to it if they're lucky, but largely it's, the bi-consult exception to the rule.
Right.
Can you share a little bit about how that just developed to be and what a typical day looks like for your team, maybe before all this?
Sure. So way back in 2009, I met with Dr. Robert Fine. He's our system clinical ethics and supportive palliative care medical director. He had first learned about child life during this time frame that was just immediately prior to our meeting, when he was requested by the wife of a patient he was working with. After he told the patient and the wife that the patient was nearing end of life, the wife said, "Okay, now I need you to tell my two boys." So it was during that moment that he came to the realization that, one, he did not have the skill set to do that. And two, that he truly couldn't say that he was supporting the whole family if he wasn't addressing the children's needs.
Sure.
So when he and I met, I had actually just been laid off from a position in adult and pediatric hospice, and we worked together to write a proposal for the position, and that position was going to be deemed a core member of the adult supportive palliative care team. And then on his own, Dr. Fine raised all the funds to get this position programming up and running. Wow. So I waited, albeit unemployed, for 2 years that it took for us to be ready to launch. But I just really knew that this was what I wanted to do and what I was really supposed to be doing. So it was finally in 2011 that I became the first palliative care child life specialist in our system, supporting only children loved by seriously and or terminally ill or injured adult patients. And since that time, our team has grown from just me at one campus to a total of 9 full-time palliative care child life specialists, and we cover the entire Baylor Scott and White Health system in both North and Central Texas. So I think, I'm sorry.
No, you're fine. I mean, that's just incredible, and I applaud your perseverance for waiting that out. That's a lengthy process, and also just how incredible to have a physician advocate like that.
I mean, he's an incredible champion, and he speaks to legislatures here in Texas, and he speaks across the country to different palliative care programming opportunities. And one of the things he always tends to do is talk about the child life aspect of our team, which of course makes me really proud. And it's really great to hear it coming from a medical director so high up. So I feel we are very well supported by him, and that has trickled down through the system since our programming began.
So what does a typical day look like for your team?
Well, prior to coronavirus, we typically, arrive at our office and we just start reviewing the charts of our current patients and those of any new orders that might have come in overnight. We're specifically going to look to see if we've had any patients that have passed away overnight or maybe very close to end of life in that morning. And then we start to begin prioritizing the day. We attend our supportive palliative care team huddle, so we can update them on support with patients they're serving, and we can assess any new patient and family needs for child life. And even though we are on the palliative care team, we're able to support families of any of the patients in our hospital that are seriously or terminally ill or injured. So from there, we might go on to meet with some of the involved adults or even the patients themselves for new consults. follow up with families. We're continuing to support and meeting directly with children of the adult patients. And then, of course, lots of documenting on all those interactions. We also attend a lot of ICU rounds and consult with staff in regard to the new and established consults, so we can stay up to date on medical statuses. And then we respond to any urgent requests that might come up throughout the day.
Okay. And then now with, coronavirus happening, are you seeing differences in, patients and families you're serving in light of the pandemic? Is your team operating the same, differently?
Well, I think it's kind of interesting. We really anticipated that once we were having to limit or extinguish our visits being in person with children and with the adults and families, we really thought it was going to be challenging to have them be as open to our support. But we've actually found that families have just been extremely appreciative of the support that we can provide and have been really understanding of the hospital visitor restrictions. I mean, obviously, they're hearing about it on the news just like everyone else. And in fact, one of the family members of a COVID patient that one of my team members had been supporting, she had been supporting her by phone, and the family member told the child life specialist, she said, as soon as the restrictions are lifted, her plans are to come up to that hospital so she can find her and give her a big hug, because she's just been so impressed with all the help that she was given. So that just makes you feel warm inside, even in light of all this. So our team is definitely, go ahead, sorry.
Are you providing the support, from, say, a child life office in the hospital, or are you all working from home?
Well, our entire team of 9 was all sent home to work remotely back on March 16th. So we are now in our 6th week of working from home. We had to figure it all out in a really short order, and we didn't have any say in the matter, but I understand that, leadership had to make that decision. We're happy we still have our positions, so that's important that we always focus on that. But we are doing all of our interactions with adult patients or with the adult family members by phone. For children, we've been doing some of the interventions by teleconference, or with teens, we've been doing some of those by phone just because they preferred that. It was really fun when someone on my team had the first teleconference intervention, and she was meeting with 2 really young kids. I think they were age 4 and 6. She shared the information from the visit with our team in one of our meetings, and she said that they were so excited they were going to be having their work meeting, just like all the video meetings they've been watching their mom have for her job. So they were very poised and ready to go when it was time for their meeting. So that was a fun aspect to, a visit when they're having a difficult conversation.
Sure.
But we have been able to advocate for children from 3 different families to have the opportunity to come to the hospital, see and say goodbye to their person just before they died. We know that during this pandemic, there's going to be a high likelihood that as this goes on, that we may have future requests that are denied. But we really all feel very strongly that it's our responsibility to advocate for those visits when the children and the families do want that opportunity.
Sure. Now, is your team working with any children of adults with coronavirus?
We are. We have worked with quite a few families with adult patients who have coronavirus. Actually, some of those families have had multiple members from grandchildren, parents, and young children that have all tested positive for the virus. So it's been, I'm sure, for those families, extremely overwhelming, and especially with the range of illness that has manifested. We've had ill grandparents where both grandparents had died, parents that were hospitalized with the virus but survived, and then their children that never manifested very serious symptoms and ended up staying with family members. So it's obviously been a challenge for all of them, and we're trying to help them navigate as much as we can. It's obviously going to be challenging when we can't be at the hospital, but a lot of the focus when we're talking with family members is to help their children to feel safe and secure during this time of this intense change and instability. We, of course, encourage them to limit their children's exposure to the news and to other media outlets. because of all the ongoing constant information they're being bombarded with. And we encourage the adults to really impress on their children and teens to come to them with the questions or concerns about the virus or about other things that are going on in the world. So in hopes that, the parents can help them navigate that information so that the children are getting the most accurate information and just from just one source. We also really remind them to help support their kids in just being kids. And while their structure of their day has changed and the parents are doing the school teaching and everything's so different, we know that the structure is very beneficial, but we also want to encourage them to try to incorporate fun and memory making activities into just their typical days. These are weird times, but times to make memories that they might not have had this situation not arisen. So
yeah,
we have. Oh, go ahead. I'm sorry.
That's a nice silver lining that it is giving people family time that maybe they wouldn't have had under other circumstances.
Yeah, I think if we look for the good, we can find it. And I think that's one thing that I've learned from a lot of families is that they are beginning to see, that as something that they may never have again in kind of a once in a lifetime situation. I mean, how often might anybody ever be locked in their house with their entire family for months on end, being the teachers and the cooks and everything else, but, getting to really spend some quality time with their family.
So I think one of the things that really inspired me to reach out to you and do this interview was the big uptick in conversations on the ACLP forum about, child life specialists that don't normally work with children and adult patients, or who it's been, kind of the irregular consult, but definitely not part of their normal work, suddenly finding that they're doing a lot more work with children and adult patients. So I was just wondering if you had any advice for child life specialists in those positions that maybe have little or no experience working with children and adults and now are suddenly being called to do so.
I think the most important advice that I can offer is, if in that situation, to first give yourself some grace. Though you may never have supported children and adults in the past, you have a strong foundation and skill set in supporting families. And most likely, and most child life specialists have at some time found themselves being asked to support on a unit or with a patient population that they've never supported for, like a child life specialist being asked to cover a HEMOC unit because of staffing challenge when they've always worked in pre-op. So the basic skill set needed for supporting children and adult patients is there. You just have to trust yourself. Take some time to breathe and process the situation, and then just focus on doing your best given the circumstances. If you think about it, families don't know what child life support in the adult setting is supposed to look like. And truthfully, they may not remember your name, or if they're able to see your face, may not remember your face, but they're going to remember that you were there, even if it is virtually. And really, truthfully, what they need more than anything is just to know that you care and that they're being heard and someone's there advocating for them and is on their side. So I think, just continuing to demonstrate the compassion and empathy that child life specialists are already demonstrating with the families that they encounter. It's much more important than focusing on what they do or don't know about supporting children of adult patients. If there's opportunity, reaching out to teammates or others through the ACLP that do have more experience working with children of adult patients. Our team is often contacted to provide insight into programming and our specific support. So we always welcome the opportunity to help, whether it's during this pandemic or any time. And I think working with this population, because this is all we do, I think we might have some unique resources that we can share and maybe some unique insights. But I think our team is really living by the mantra that we're all in this together, and we're truly interested in doing what we can to support fellow child life specialists that might be seeking some guidance.
That's incredible. And on behalf of the entire child life community, thank you for kind of making yourselves available in that way. And we were talking about silver linings a few minutes ago, and it does seem that, potentially another silver lining in all of this is the possibility to make child life services for children and adult patients more integrated within, the fabric of healthcare and within hospitals, and make it more of a normal thing than perhaps it has been. So, an opportunity for child life, it seems,
Right.
to, show what we do, and show that it's more than, birth to 18, and that there's a place for us in these really kind of extraordinary situations, extraordinary times.
Absolutely. I agree.
So before we wrap up, also just wanted to, kind of check in on you and your team on a more of a personal level, how everybody's coping, managing. Self-care has become a big topic in the last month or so. If there's any self-care tips, maybe you or your team has found helpful that you'd like to share?
I think right after this started and we were sent home, we kind of as a team decided that there was so much importance in us meeting more frequently than we generally do. We usually have staff meeting once a month, and we decided as a team to start meeting twice a week, and we do that through Microsoft Teams. Mm-hmm. And we always start our meetings with team building activities. So someone from the team volunteers to lead that every meeting. And one of the ways we end each of those meetings is by everyone sharing something positive that's happened in that day or during the time since our last visit. So I think, by like most people, we're having good times and we have not so good times, both as a team and me personally. I think it's really hard to see the world changing so quickly and wondering if it's ever really going to return to the way it was, or, how we're going to end up in this process. And I found that it's really vital for me to focus on my people, my pets, and things I'm grateful for. I look for positivity that's still occurring in my life and in the world around us. And it's been wonderful to see people helping each other in ways that they may never have helped before, and neighbors that are really, truly being neighborly and thoughtful to each other. I think that looking for the beauty in the ordinary things is something that's been really helpful for me.
I like that way of putting it, the beauty in the ordinary things. I'm going to borrow that one. Well, Cinda, thank you again so much for making the time to have this conversation with me. I hope that this video is helpful to those in the child life community that are, kind of grappling with supporting children and adult patients. And I just appreciate you sharing your time, your expertise, and some advice for the rest of us.
Thank you. I appreciate it. And like I said, I really am serious. If people want to reach out to us for help in any way, we are happy to help. We all want to be in this, together truly. And that means we're happy to share what we know.
I have a feeling you'll have some folks taking you up on that. Well, thank you again. And to everyone else, we'll see you next time for our next Child Life in Action.